In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. So for differentiating hip pain, and I put hip pain in parentheses because some patients point and they say, I have hip pain, but then when they actually point, they're pointing at their lower back or in a muscle or in the sacroiliac joint or somewhere else that's not actually the true anatomical hip. So first you got to define hip pain to begin with, the location and the tissue responsible. Again, all of these things are just so that you get a better understanding yourself so you can get to the bottom of your problem once and for all. If you understand these conditions, you will be a better participant in the process of allowing your body to heal. If you don't know, then unfortunately, you're kind of like held hostage to taking someone else's word for it. Knowledge is truly power. That's why we strongly believe in empowering our patients with knowledge on how the body works, on how your body works. So is it in the FAJ, the femoroacetabular joint? That's the ball and socket joint that your femur or your leg bone fits into the socket inside of the acetabulum in your pelvis. That's the hip, ball and socket joint. That's the proper hip. Or is it a muscular issue? Meaning you've probably heard of like tight hip flexors, those are the muscles in the front of the hip, or deep external rotators. You've probably watched YouTube videos before of people going through and trying to dig into the piriformis muscle because they say low back pain and sciatica and hip pain comes from the piriformis muscle. You've probably heard of this before. There's little pieces of truth in all of this, but it's applying these truths to your specific condition. That's what's important. Is it SIJ in origin? What does SIJ stand for? It stands for sacroiliac joint. We'll talk about all these things in detail. Is it referred from elsewhere, like from your lumbar spine? How could that happen? How could the lower back region cause hip pain? Or is it from a postural distortion? This is less well known as far as causes of hip pain or other dysfunction in the body, but they're called postural distortions. We are experts in identifying and treating these, and this causes asymmetrical loading, meaning you are loading one side of the body more than the other. That causes problems with the tissues and the joints and can create pain and dysfunction. So first, let's talk about femoroacetabular joint. On the left, you see a normal hip joint, and then over on the right, you see a arthritic hip joint. So you can have this deep joint pain, and if you have that pain and that abnormal wear and tear and loading in the joint over a long period of time, that can cause the joint to respond to those increased loads and become arthritic. Arthritis, in this case, we're talking about osteoarthritis, which is the most common type of arthritis that people complain of throughout the entire body. It is osteoarthritis. It's a mechanical problem that causes the joint to wear out prematurely. We'll discuss many examples of what a mechanical joint problem is. Arthritis, we talked about that. Now let's look at also too, this is what the body actually looks like, is there's all this connective tissue. There's a ligament that is very dense connective tissue that connects bone to bone. Ligaments connect bone to bone. Muscles go and turn into tendon, and then the tendon connects to bone, and muscles are contractile, and the purpose of a muscle is it contracts and it causes a limb or a joint to move. It causes joint motion. A ligament causes joint stability. That's the purpose of a ligament. And you have muscles and ligaments all over the place, and muscles connect tendons, connect to bones. There's something called a labrum. Probably heard of this before. That could be a deep type of hip pain inside of that hip joint. That's the inner surface of the acetabulum. The labrum can have a problem. That can oftentimes cause like a catch or a pinching because that cartilaginous labral tissue can flop over and it almost feels almost like a hangnail inside of that joint. And sometimes those can self-resolve. Sometimes those are surgical cases. But this is what we look at in the category of femoroacetabular joint origin pain. And then there's a component of, is there proper alignment of that femoroacetabular joint? If the head of the femur into the acetabulum isn't sitting nice and centered, that can aggravate part of the joint in a abnormal way. It can cause inflammation. It can cause arthritic changes because of asymmetrical loading. We're going to talk about more on that topic of alignment as we get into the presentation. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion x-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.